Hi, good evening. Austin Mayor Steve Adler, you got a minute? Let's go ahead and take a look at the virus numbers. We're going to try and put that into context as we've been talking last weekend and this weekend about how we're getting dangerously close to the red zone. Let's take a look at the numbers today and see what that tells us. We're going to continue watching over the next several days. We'll take a look at the UT model because that's going to be some germane information, and then just a couple things, and then we'll stop. Look at that chart in the middle. That shows where we are with respect to hospitalizations. You can see that for the longest time we were down kind of in the blue area. And then we started moving up to the yellow area. That's when we had the real peak this summertime. We moved up to the yellow area. We tried to stop. It took us, once we changed behaviors, that line continued to move on up in the red, even though we changed our behaviors. But because we changed our behaviors, 2 weeks after we did, and each of those dots represent a day, the numbers started coming back down. It came back down. We got real close to going back into the blue zone down from the yellow, bounced around in yellow, then moved up to orange, day stage 4 on November 19th, which was a week before Thanksgiving. And then you can see after the 19th and around that time, we stayed in orange, but got a little bit closer to yellow, but then we started rising. And that rise that you see all the way to the right looks precariously like and dangerously like the rise that we see to the left when we had the peak. Not going up quite as fast. We have more dots that are part of that rise than this summer. But you can see how close it's gotten to red. Red is when we have 50 hospital admissions on a 7-day moving average. You can look at the orange numbers to the left and see we're at 47. 47 is precariously close to that red area. But the number of actual cases today was 40. The number of cases yesterday was 34. We explained 34 yesterday because it was Sunday, and usually numbers go down on Sunday. The 3 days before that, the number was up in the 50s. That's what we were reacting to on Thursday, Friday, and Saturday, down Sunday. We were all waiting to see what would happen today, and it's at 40. Now, that could mean a couple different things. Actually, it could mean more than that, but at least a couple different things. It could mean that we're seeing the same kind of pattern we saw yesterday, and tomorrow's numbers will get back up into that 50 range. And we need to really seriously be looking at red kinds of indications. It also could be that what we're seeing is a more narrow surge that is just associated with the Thanksgiving weekend itself. That actually that weekend, that Thursday through Sunday Thanksgiving weekend, or maybe just on Thanksgiving Day, we had too many people that were around too many other people, probably in close proximity, not wearing masks. It takes about 2 weeks before that infection on Thanksgiving Day would work their way through people's bodies, show up as an infection. Several days later, if they're sick enough, they end up showing up at hospital admission. About 2 weeks for it to run that course. It could be that the number's going to go back down here, and maybe we plateau at about 40 and just stay there for a while. And then all we see is that Thanksgiving Day. I reached out to some of the hospitals today, as well as Austin Public Health, to see if the contact tracers are seeing people right now who are coming in, and to see if there was a link between them and behaviors over Thanksgiving. And the early anecdotal indications are that that might be true. That a lot of people in the hospitals right now are people that really let down their guard on Thanksgiving or right that weekend. 2 big gatherings with extended family members, friends, didn't really wear masks, hugged people. We've talked about this before, that for some reason we'll wear masks around strangers, won't wear masks around our family members because we figure our family members aren't going to be carrying the virus because we know them, and the virus doesn't work that way. But anyhow, so we're going to continue to watch the number. I'll show you what the UT modeler shows us in just a little bit. And you can see the concern that we have as we continue to watch that number. It wouldn't take but a few days above 50 for that 47 that we see in the 7-day moving average to move over. The number of people, 7-day moving average in our hospitals, ICUs, are the numbers that you see in green. I am concerned, even though the number's gone down to 40, that the number of new cases is up at 415. That's a contraindication. At 415 new cases today, that would seem to indicate that our numbers eventually for the hospitals are going to go higher, because those new cases today that we're seeing don't show up in hospitals for another several days to a week. So I don't want people to get overconfident with that 40 number, because on this very same page is a number that is as scary as the 40 is kind of reassuring. 415 new cases, the most we have seen in a while. 305 yesterday and 355 the day before that, 7-day moving average of 339. Let's go ahead to the next page, the next chart, again, focused on ICUs. That's where we're going to have our biggest issue. 86 people in our ICUs. That number was moving up. It was in the 70s, moved up to the 80s. It went up to the 90s this weekend, 90, 91. Today it dropped back down to 86. That's a good sign. That tracks in the good news column with the 40 new admissions today. But the 301 folks that are hospitalized, significantly above the 280 for our 7-day running average. The 301, an increase in the number of people in our hospital versus yesterday, is an indication that has us concerned. So you can see why it is that the county judge and Dr. Escott and I are watching these numbers every day, because at this point we're getting these indications that point us in both directions. Let's take a look here on this page. 507 people have passed away. That's an increase over yesterday of 2. So 2 families have lost loved ones today. Total number of new cases, 42,856. Let's look at the University of Texas model page so that we can see what the model is showing us. You know, it's interesting. We met with the modeler today at University of Texas. We do that on a weekly basis here. Most recently, at one point in the summer when the numbers are up, we were meeting 3 times a week. This week, because of the concern in the numbers we're seeing up at close to 50, we're going back to twice a week. Came real close to doing it 3 times a week, but we're going to start with twice a week and then see whether we move to 3 times a week next week. I mentioned that just so that you can see that the Emergency Operation Command, all those people that get together for that meeting, are taking this real seriously and are concerned. Jeannie, why don't you take me out of the picture so that the chart is larger? This is available on the website. The R number, which talks about infection right now, is at 1.23. Odds are the pandemic is growing, as we know that. More infections today than 60 days ago. That chart you see in the middle is the same chart you saw on the color-coded chart, but rather than being an illustration, this is actually a graph. Those green dots show you what the actual numbers are. The solid green line shows you the 7-day moving average. And then when we get to the right side of that, you can see all those gray lines. That's what the model suggests are the possible results in our future going out about a month. You can see that January 21 day is kind of right in the middle of the area that is January. The December 2020 words are about in the middle of December, or the beginning of December, actually, because the dots that you see, if Janine were to hover her marker around one of those dots, you can see the day. The days she's gone too far. Once you go on back to the green dots, and you can see when the thing is solid, that's registering an actual day. So on the 12th, you could see the number was 58. If Janine would move to a different dot, you can see that on the 13th, the number 34 on the day. And those are the numbers that we actually see. And then the model then says, okay, this is These gray lines are all the possible outcomes in the future. Each one has the same much chance as anything else. And that aqua line is the mean line of all the different gray options. And if you put the marker on the aqua line, it tells you what the model by mean is predicting in the future. So on the 17th or the 21st or the 22nd, here's what the date 18 predicted that the number might be 59. So today is the 14th. We're down at 40. The model would suggest that the mean, the kind of where there's many scenarios above and below, would have us at 59. On the 18th. Interesting to note that just a week ago on December 8th, we were down in the 30s with this number. And that's the concern, that it went from 30s to just under 50 so quickly. But look how vertical that line is. I mean, it doesn't take long for us to get above 60 hospitalizations, get above 80 hospitalizations. That aquamarine line has us reaching 100 here in January. There'd be a significant chance that we would get all 200 rooms filled by the end of the year. In fact, this model would predict about a 37% chance that we would reach 200 rooms occupied in the ICUs by the end of December. So that's why we're continuing to look at these numbers. These models are constantly adjusted, by the way. They make certain assumptions about how long patients will be in ICUs. We have ICU beds, and some of them are for COVID patients. We have to keep some available for heart attacks and car accidents. So this model has assumptions about how long someone's in an ICU with COVID, how many of the patients that go into the hospital end up going into the ICU with COVID, that ratio. And these numbers change over time. So the way that our hospitals are dealing with this virus is different now than it was in March. And as the numbers change, as we're able to keep more and more people out of ICUs, keep ICUs a smaller length of time in ICUs, the assumptions change and the models continue to change. At this point, we don't know when or if we're going to be going into the red area. The county judge Brown and Dr. Escott and I continue to talk about what those steps might look like. Things like curfew to after 10:30, let restaurants stay open till 10, but try to do something about the social gatherings into the evening, relying more on delivery and takeout. Maybe taking a look at extracurricular activities at school, because that's where most of the infections are being passed in the school environment. You'll hear more on that later in the week as we continue to look at those kinds of options. The other thing we should all be considering is doing everything we can to help the businesses that are really hurt right now, especially the restaurants and hospitality industries that are the first to not be able to open, and the ones that are hit as we change from one risk zone to the other. You should let restaurants do the cooking as much as you possibly can. Do takeout, do carry out, buy gift cards in retail shops, over tip your wait staff and the folks that are taking your order right now. We really should, to the degree that your pocketbook allows, be supporting businesses in our community as best we can, because we don't have that much longer to go on this. The vaccine made it to our city today, made it to the University of Texas Dell Medical Center. They're going to start giving the vaccinations out tomorrow. We don't know exactly when it'll show up in the other hospital systems. Could be a day or 2, 3 behind. There are a lot of the virus that's coming out relative to this initial need, but not enough for everybody. So the first vaccines that are coming in are going to be given to the people who are our health workers that are dealing with the people that have the infections. I'm really happy that we're able to start doing that. I've been really concerned about those nurses and doctors that are dealing with people who have the virus and then go home to their families, taking risks both for themselves and for their families on our behalf. We need to get them vaccines just as quickly as we can. There are about 20,000 hospital workers and EMS workers in our city. That's the next group to get it. Our first responders that are interacting with people that have the virus again and then go home to their families. Again, those families taking risks, those first responders for us. As we move through those folks that are delivering directly care to people who have the virus, the next group that we'll hit will be that group that really suffers the greatest ill consequences. People most likely to pass away. We're talking about older folks in nursing homes. We have about 4,000 people that are staffing those nursing homes, about 12,000 people in long-term care. A lot of the mortality that we're seeing comes from those places with those vulnerable people, and that's the next place that the vaccinations will go as they begin to come into our city. And then we're going to be hitting again the people that, if they get the virus, face the most horrible consequences. We have about 30,000 people in our city that are over 80 years old. We have about 50,000 people in their 70s, about 115,000 people between 60 and 69. 81% of the deaths that we're seeing because of this virus are occurring in people over 60. Now, of course, they get it passed to them by oftentimes people that are much younger, which is why all of us need to protect against getting the virus. Not that it'll send us to the hospital or we'll die, but we just can't be carrying around this virus because eventually it's going to find somebody who is vulnerable and susceptible. But about 20 million, it looks like, of people to get the 2 doses, about 40 million doses by January, into January in the country. That's what, about a little over half of the well, it's about 5% of the population in the country, about 330 million. Is that what it is? 330, 350, somewhere in that range. So if we have 20 million people, we're somewhere in the 6-7% population in our city. 6-7% of the population would be about 70,000 people. So we'll work through those numbers. That's kind of what the numbers look like, in December, very first part of January. And then we'll continue to work our way through the people that are most susceptible, that have the underlying conditions. The people that are setting the order of who gets it are the experts and the scientists. The state and the federal government scientists, our local folks. Austin Public Health has been developing its vaccination plan now for a couple months, regularly meeting with, and I've participated in calls with the vaccination providers in our cities. Everybody is poised and ready for this, but they're making these decisions based on science and data who actually gets it. I will be getting the vaccine myself, but in line with everybody else, according to my personal characteristics. And at the same time, everybody with my personal characteristics get it. I'll get it. I hope to do it as publicly as I can, because I think that's an important message to send. This virus is showing to be real safe and real effective. So everybody really needs to consider doing this. It's not going to be required as we roll this out, but my hope is that most everybody who has the opportunity to be able to take this vaccine will in fact be able to do it. But that's how the vaccine's going to roll out. I'm real happy that it's hitting our hospitals. Thank goodness we can get it to those frontline healthcare workers so that they can remove some of the risk for them as well as risk for their families. Tomorrow is election day. If you have not voted in the early election, please make sure that you vote. There are 2 council offices up for election. There's the seat held right now by the incumbent Jimmy Flanagan in District 6. That's having an election, as well as Council Member District 10. The incumbent is Allison Alter. That election is happening. Also, AISD School Board District 5 is having an election, and then an at-large Austin Independent School District Board, which means everybody anywhere in the AISD district is able to vote. Lots of voting locations, real safely run. If you have not voted, please make sure that you vote tomorrow. Polls are open from 7 a.m. to 7 p.m. You can go online and get locations. What's being shown right now is the place to go for Williamson County election sites. I want everybody, this is the Travis County election sites that you can see as well. Austin Public Health is telling us that not everybody is answering the phone or answering their questions. When a contact tracer calls you from Austin Public Health to try to ascertain who it is that may have come into contact with someone who has been found to have the virus, please make sure that you answer those questions when you get the call so that we can better find the virus, isolate the virus, and make sure that everybody that might be getting it gets absolutely the best possible care. And then finally, I want to remind everybody, let's take care of the businesses right now. We have put on the website at the end of last week for some of the chambers we have. Tonight, the Greater Austin Hispanic Chamber of Commerce and the Greater Austin Black Chamber, their websites are shown. Find some local businesses that you can help, gift cards, takeout, internet shopping, and make sure that you overtip your wait staff and the stuff and the people that are helping to the degree that you possibly can help. Finally, there is a photographer, an Austin photographer. She's doing a portrait series of women essential workers. And she is in search of folks that might want to be part of her portrait series. So if you know an essential worker in Austin, Travis County, you can nominate her for this portrait series. There's the site that you can take a look at. Nominations open till January 15th. Might be a happier way to remember this time. Good news tonight. The vaccine has come to our city. It's starting to get out to the people that are at the front lines and most at risk, but it's going to be getting out to everybody. My best guess at this point is that as we go into the summertime, everybody who wants the opportunity to have gotten the vaccine will have had the chance to do that. Remember that even as we begin to get the vaccine to people starting this week, it's not going to be very many people. We're going to be wearing the masks and social distancing for several months. So still just relax, hunker in with that because we're not out of the woods. And it looks like we might have one last big surge that we need to deal with. Let's keep our fingers crossed to take a look at these numbers, see if it was just isolated to that Thanksgiving weekend. But what that does tell us is that over Christmas Day and Christmas Eve, we can't be having big parties. We need to be staying with our household units. New Year's Eve this year is not going to be celebrating New Year's Eve at midnight out with a gathering. It's going to be at home with those that we love the most and we live with and that we want to celebrate many, many, many more Christmases and New Year's Eves in the future. You all take care. Be safe. Good night.